All right. So far, looking good, better than last week. So give me just a minute to share into our group. If you are already joining us, drop us a comment. Let us know where you are watching from. Okay, I think we are live. So welcome everyone to our TBI talk. Today I'm here with Dr. Perry Maynard from Integrated Brain Centers in Denver, Colorado. And today we're going to be talking about the keto diet and brain injury and the pros and cons of the ketogenic diet. So welcome, Perry. Happy to have you here.
Yeah, great to be here. Thanks for having me.
So maybe let's just start by, just a breakdown of what is the ketogenic diet.
So when you're looking at a ketogenic diet, and I think this is a good place to start, right? Because the ketogenic diet has become quite popular over, I don't know, probably the past 10 or so, 15 years. And I think you're seeing all sorts of variations,
Yeah.
It was first, so really simply when you're looking at a ketogenic diet, right, it is a diet that relies primarily on fat for fuel. And there's different ratios. When you look at its original use in seizures, which is where it kind of got a lot of usage medically early on. I mean, you're looking at anywhere from like 70 to 80% of your calories coming from fat. You're seeing all sorts of different variations now of lower percentages, but in essence, to keep it simple, a ketogenic diet is a diet that relies primarily on fats for fuel, right? So like if we're thinking of macronutrients, so we have fats, we have proteins, we have carbs, right? And so traditionally we think of maybe a well-balanced diet as maybe 30% of one, 30% of another, 40% of another, or maybe we have a low fat diet, right? There's percentages change. So when we look at a ketogenic diet, it could be something as high as, let's say, 70, 80% of your calories coming from fat, and then however much coming from protein and carbohydrates. So in simple standpoint, so someone might be saying, well, what is the ketone aspect? And ketones are the metabolic fuel that is created from a high-fat diet. So they're what are called ketone bodies. And there's three kind of main ketone bodies. The main one everyone discusses is BHB or beta-hydroxybutyrate. And so these ketone bodies are the fuel. So ketogenic diet, so a diet that is producing high levels of ketones, and that largely comes from a diet that primarily is fat, whether it be saturated fat, polyunsaturated fat, monounsaturated fat. That's kind of a different discussion, but to keep it simple, it is a high fat diet, right? And for a lot of people for the longest time was very off-putting, especially when we had this whole push for a low fat diet for the longest time. I think a lot of people think of a high fat diet and they just think of like their arteries getting clogged up.
Right.
It's I think things are starting to change with it, and we can talk about pros and cons. And even I've kind of changed my thoughts on it. I think, a little more gung-ho and bullish early on. And I think it's got a time and place, but I don't use it quite as much as I used to. We can kind of talk about why.
Mm-hmm. Yeah. And, it's often dubbed like the low carb diet, right? Because you are trying to eat much higher levels of fat and protein and kind of eliminating carbs almost altogether, which I don't know. Carbs aren't the enemy, right? Like, I don't know. I have issues with the keto diet. Carbs aren't the enemy. It's the type of carb, right, that you're eating, empty carbs versus whole carbs. And
yeah, I think there's a lot. Yeah, I think where we have to be careful is demonizing any food group. I think we've gotten in this really bad habit of Right now, it was carbohydrates for a while, it was fat at one point.
It
Right
used to
now,
be fat. Yep.
yeah,
Everything came out low fat.
yeah, right now it's animal protein, right? With a big movement in vegan, is, animal protein is the devil, or, even in the anti-aging world, protein is looked at as a bad thing because of its stimulation of anabolic pathways. So you have a lot of longevity people speaking out against protein. So it's happening again, right? It was fat,
Yeah.
it's carbohydrates, it's
It's
protein.
always going to be something because we
Yeah,
live in a capitalistic society and someone's always wanting to sell you something. So keep
yeah,
that in mind as well. When you're
it is
hearing about all
true.
these diets.
Really, as we might be a little bit more specific to brain injuries, but hopefully we'll come back at the end, because when you look at some of the more nutritional data, and you look at like ketogenic diets up against low fat diets, when you look up against other diets, a lot of them perform pretty similar when you control kind of the amount of intake, right? And sometimes it can,
Mhm.
and this is a different discussion of, maybe let's talk about weight loss, of also just energy. And a lot, and this is not the point of this webinar, so I won't get into this too much because I know this will stir a lot of things up, of energy in, energy out. But when you look at some of these diets head to head, when you control for certain things, there's not a magic aspect to a ketogenic diet. Once again, we'll talk about, I think there can be some magic with it, but we have to understand, like, what are we
Mhm.
trying to achieve with it? Just like you said, why are we using a ketogenic diet? What is the reason for that? And I think before someone starts a ketogenic diet, we have to be asking, like, what are we trying to achieve with this? Because um, maybe it doesn't match what our goal is, right? And we might be able to
Yeah.
fix that with a more well-balanced diet, with protein and carbs. So the question is really going to be, why are we using the ketogenic diet, and what are we hoping to gain from it?
Yeah. Yeah. So let's talk about the ketogenic diet in relation to brain injury. Because I know that it has been shown to be helpful early on after a brain injury.
Yeah. So we can look at some of the different proposed mechanisms, like we mentioned earlier, where there's probably the most data or evidence, or where it's been used the most, is seizures, and some drug-resistant forms of epilepsy. And so that's kind of where it early got its grasp. I think it was out of Johns Hopkins, where that kind of started. And so I think a lot of the proposed mechanisms come out of that as well. There's a really good expert, just for people who are interested more in this topic. Dom D'Agostino is kind of one of the leading experts in this topic that we're going to discuss. I think he's out of the University of Southern Florida, or somewhere in Florida. But his research is on epilepsy and ketogenic diets as it relates to military divers or Navy SEALs who use rebreathers and are at risk of oxygen toxicity. So he's a great resource. He's got a ton of different stuff. So going back to it, when we look at some of the proposed mechanisms, we kind of look back at what occurs in epilepsy. And so when we look at ketogenic diets, there's a few different proposed mechanisms, and then I'll try to tie those into how those relate to brain injuries. So one is this concept of rebalancing or normalizing excitatory neurotransmitters and inhibitory neurotransmitters. So in our brain, we have a whole bunch of neurochemicals, but to keep it simple, there's two big ones: glutamate and GABA. This is oversimplified, but glutamate traditionally we think of as an excitatory neurotransmitter, right? That's not bad. It just means it excites circuits. And GABA is more of an inhibitory neurotransmitter. So it kind of calms down or inhibits circuits. So for a while, when we look at seizures, right, it was this thought of, is there this excessive glutamatergic or excessive glutamate activity that's causing this hyperexcitability within neuronal circuits? And so there's some data showing that ketogenic diets can create more recycling from glutamate to GABA versus a specific enzyme called GAD that helps to recycle glutamate to GABA. And so we get higher GABA production. And this is some of the proposed mechanisms of why it can help with anxiety, mood disorders, but also, once again, in epilepsy. And so when we look at ketogenic, or when we look at traumatic brain injuries, we know that one of the proposed mechanisms early on that is dangerous is this hyperexcitability. So if you remember from past talks, when we have a concussion, we get a huge fluctuation of sodium and potassium in and out of the cell, and we get a lot of hyperexcitability of neurons, right? So neurons start firing really unstable. And so if we can have more GABA production, can we calm things down? So it's kind of like the brain goes from oscillating at maybe 1,000 RPMs to then after a head injury, it's oscillating really high. And that high oscillation can burn through fuel really quickly and cause more neuronal death. So going back to one reason why we might want more GABA production is to kind of keep things from escalating too quickly. So that's one proposed mechanism. Another one is the regulation of energy. So like we talked about, for the longest time, we've always thought of the brain only being able to use glucose, and it does primarily use glucose, but it can also use ketones as fuel. So like we talked about, beta hydroxybutyrate is a ketone body, and our brain can use that as fuel. So another thing when we look at brain injuries is that, like we said, we get very unstable energy production in the brain, and we use a ton of energy to try to re-normalize that sodium potassium balance within a neuron. And so it creates this kind of energy crisis. And so a proposed mechanism is, okay, we have this energy crisis and we're burning through glucose trying to stabilize all these circuits. Can we get a more stable form of fuel in the form of ketone bodies? So the second proposed mechanism would be ketones as another fuel source to try to keep the brain, in essence, well fed through a very traumatic experience. Okay. And that also, when you look at conditions, some of the proposed mechanisms is that individuals become insulin resistant, right? So their ability to uptake glucose, like when you look at PET scans, which look at glucose utilization, those aren't so hot. And so one of the ideas is, can ketones act as a alternative fuel? So if they're not getting fuel in the sort of source of glucose from maybe, once again, being diabetic or being insulin resistant in the brain, can ketones serve as that external source? So that's another mechanism of how it could be beneficial in some of these other neurological conditions. And then another proposed mechanism is more of the anti-inflammatory component. And it's not totally clear what is going on per se. And what I mean by that is, it's not clear whether it is the ketone bodies themselves that are the anti-inflammatory component, or if it is other things occurring from being in a ketogenic diet. What I mean by that is that when you look at ketogenic diets versus, let's say, exogenous ketone, so I drink, a bolus of beta hydroxybutyrate, whether in the form of salts or esters, you can get some of the benefits, but it doesn't seem to be as profound as someone who is maybe eating in that form. So the question becomes, is there something that's occurring from calorie restriction, or is there something occurring from you producing the ketone bodies yourself, right? So the question is like, are the ketone bodies a byproduct of something else occurring? Either way, we know ketogenic diets can have a anti-inflammatory aspect on the brain via the inflammasome and some other things. Once again, that's another proposed mechanism in epilepsy, but also there's a psychiatrist who's getting kind of popular, Chris Palmer. I can't remember his name, but he's a psychiatrist, I'm pretty sure, who is starting to discuss his treatment of things like schizophrenia, bipolar, and other psychiatric disorders with ketogenic diets. And he uses very similar proposed mechanisms, of one being a neuroinflammatory. So we know there's proposed mechanisms in schizophrenia and different psychiatric disorders. That could there be a neuroinflammatory model to that? Same with epilepsy, same with concussions. And so a ketogenic diet can affect the inflammatory state of the brain, which, once again, when we're looking at a concussion, we want inflammation, but we want to be able to keep it in check. Right? We want inflammation because inflammation brings the ability to heal, but we don't want it, a year out, right? We want it to be able to resolve. And so that is another proposed mechanism of how the ketogenic diet may be beneficial for traumatic brain injuries.
And so this brings me to a question. So I have several friends who've done keto, and there's what we call dirty keto.
Mhm.
So like true ketogenic diet, you're eating more whole foods, right? Um, Dirty keto is where you might be bringing in a lot of cheese, cream cheese.
Mhm.
You're compensating, you're cutting out the carbs, so you're compensating with something that's just full of bad fat, right?
Mhm.
Um, so I'm curious if there's been any research on the dirty keto, if that's as anti-inflammatory as traditional keto. Does that make sense?
Yeah, no, it definitely makes sense. And I don't know. And to be honest, I would probably say that when you look at a lot of the research, and especially like animal models as well, like it would be on more of like the dirty keto side, because I don't think they're too concerned, and it's easier and it's cheaper. So I am not aware of any research comparing a quote unquote, let's say, whole foods versus more processed, or even like one that includes dairy fat versus non-dairy fat,
Because I just
saturated
can't
fat.
imagine heavy processed foods being
Yeah,
anti-inflammatory.
it's interesting, I think, and that's where I think you're looking at possibly two different things, right? So could there be um a proponent where, one aspect is maybe an individual that has issues with dairy, is it more inflammatory versus an individual who doesn't? I think that's where you're looking at, is there are calories equated for, like, are they in a caloric deficit versus a caloric surplus? But like, to answer your question, I'm not aware of anything comparing the two. It would be interesting and to see if
Yeah, it
there's
would be.
differences. And like I said, if anything, you find honestly that a lot of the research and other things aren't really taking that into consideration, and actually they're still getting that benefit. So I think that's kind of the interesting piece. And you've even, I'm sure, seen that clinically, I'm sure, early on with seizures, where it may not be what people look at as like an ideal diet, but they still have clinical results from it. And so that's where I think, you can look at it from different angles, and the goal becomes like, what are you trying to achieve, and does quality matter as much versus someone who's trying to achieve something else, if that kind of makes sense. I mean, of course, when we're doing it, we strive to do more on the whole foods, or once again,
Mhm.
kind of steer away from more processed foods, just because they tend to be more hyper palatable, and individuals tend to then overeat them, right? And then it kind
Right.
of mixes with satiety and all those things. So of course, once again, we're wanting to always prioritize, vegetables, fruits, whole foods, because of all the benefits that come with them, versus a diet. I think in general, a well-rounded diet, and what I mean by that is that, like, a ability to eat a variety of foods. I think any diet that becomes super restrictive is going to have its downfall. Once, whether
Hmm.
that is AIP, autoimmune paleo diet, whether that is something like FODMAP, whether that's something like keto, carnivore, all these things people benefit from. But I think in individuals that don't really need them, do you need to be restricted? Like, I think we should be able to tolerate foods, right? We should be able to tolerate vegetables, right? As the carnivore diet is anti, like, we should be able to handle different sorts of plants. And I think there's plenty of data to show that vegetable intake is associated with, decreased mortality. We should be able to, animal protein has its role. So I think, going back to your point, we strive, if we're using something like a ketogenic diet, to have this wide variety. The other piece too is, in some individuals, the goal is not long term. Maybe someone who's
Yes.
drug resistant epilepsy, that is a lifelong thing. But a brain injury, like, my goal would be to get them back to a quote unquote normal diet, where they're having carbohydrates or these different things. So like, I look at it as a short term thing, and then trying to get back in. But
Mhm.
we try to make it less of what you would think of constitute as a dirty quote unquote ketogenic diet, where it's not, processed keto bars, that are 1,000 calories in this and
Yeah.
that,
And full of
versus,
like alcohol sugars and Yeah.
So once again, I think it all becomes a nuanced discussion of the goal, how important those things are. Can you still get the benefit, costs, right? All these different things. What will a patient adhere to? All these things are really important. And I think that's the big thing that no one discusses is all these things look really good on paper, but how do you get someone to adhere to it? Is it affordable? Is it doable? Can you get caretakers to help with it? That's where I find the most difficulty, because I think it takes a good amount of work, like we may chat about, in like, what does it even mean to be in ketosis? What is the therapeutic range of ketosis versus someone who, blood versus breath versus urine strips versus someone who doesn't even test,
Yeah.
and what that might mean. I think those are all really important as well.
Yeah. And so, what would be some of the negatives of being on a keto diet? I think we've covered, some of the pros.
Mhm.
So what could be some of the negatives, or who might be a type of person who shouldn't do keto?
Yeah, I think one of the biggest populations where you need to be careful, and this is just with any severe dietary restriction, is eating disorder. So anyone
Mm,
who has a history of disordered eating, I think you need to be very careful, right?
yeah.
As a population where there already might be some issues with certain foods or body image, or that's where I'm hesitant to label foods as bad or good, because I
Right.
think that can be dangerous for individuals. So of course, anyone with an eating disorder or a history of eating disorder needs to be very careful of any type of restrictive diet. Um, I think individuals that are maybe on the lower side from a weight standpoint, so like ketogenic diets can be very effective in
Like
weight
maybe
loss.
underweight.
Yeah, someone who's underweight, someone who's malnourished. I don't tend to be, because once again, as you get more restricted with a ketogenic diet, like you said, like if you are just eating sour cream, let's say, are you getting the full variety of nutrients from a balanced diet that has fruit, vegetables, other animal sources of protein? So I think you can see some nutrient deficiencies in there. So if someone's
Mhm.
already on that end, and of course, serious health complications. So, there's talk of using ketogenic diets in cancer, but you of course always want to work with your doctor and your oncologist on that. But one of the biggest things is cachexia, right? So where you get this muscle wasting and weight loss. And so when people are on ketogenic diets, what I tend to notice too is that they get into calorie restriction a lot of times. So you
Mhm.
see people lose weight. So you want to be careful in individuals who are maybe a little bit more on that side where you don't want to produce more weight loss. I'd say those are like the biggest things I see of individuals where you want to be careful. From a downside is, once again, just adherence. It's hard for people to adhere to. The other piece, like I said, is I find people, it can go either way. Sometimes people can overeat and think, oh, I'm on a ketogenic diet. This is good for fat loss. Well, if you're eating 4,000 calories a day and you really only need, let's say, 2,000 to get by, um, is that going to be the best diet for weight loss? So I think individuals can overeat thinking like, hey, it's okay, I can eat fat. But the problem is if it's hyper palatable and they're just eating in excess, and then vice versa, I see this more of a problem of ketogenic diets when they're mixed with intermittent fasting. Those
Mm.
individuals tend to find undereat. And
Yep.
not that caloric restriction is bad per se. I don't find clinically, and the data might argue different, but I don't find clinically working with patients every day that heavy caloric restriction individuals do very good with who are trying to
Mm-mm.
repair a brain injury. So
Right.
that's something I see quite a bit where they're like, oh, I'm doing a ketogenic diet and I don't start eating till 1 and I stop eating at 6. You've skipped an entire meal. So my question is, are you getting those calories in at some point, or are you now just down another 500 calories? And once again, if you're trying to lose weight and that's sustainable, then great. If you're trying to recover, I don't find that to be super helpful. And I find more people do better when you shift them off of that. And then another very common thing can be GI distress, right? So when you look at your gut and different things it uses for fuel, right? You have one camp that discusses the importance of fiber. And right, then you have the carnivore and the keto where, you don't need fiber, and we're not going to get into that discussion. But, when we look at bacteria and maybe they're used to fiber for fuel, and then all of a sudden you shift someone into a ketogenic diet where a lot of times there's very little fiber coming in, unless someone is being purposeful of getting fiber from vegetable sources or from supplements. You now have gone from maybe adequate fiber to very little fiber, right? So you can see GI distress from that. So I see GI complaints, either more undernourished or more nourished than they need to be. Those are some, and then the other thing is, like I said, is the eating disorder, and even doesn't clinically have a diagnosable eating disorder. I think orthorexia, right, or these kind of subclinical eating disorders of people who are so hypervigilant of like, I can't eat this. I can't eat this because I heard this was bad, or I can only have 40 grams of carbs, and if I get 60, it's the end of the world. Maybe for someone who has epilepsy, that's a huge difference, but for most individuals, it's not the end of the world. And I think that stress creates more harm than the good that the diet could be coming from. So those are really the cons I see with a ketogenic diet. And I think that's why having a really good team and a really good plan makes it successful versus someone who, just bought a book and is trying to do it on their own. It can be very overwhelming.
Yeah. Yeah. And I mean, the main complaint that I have with keto diet is it's cutting out almost all fruits, and a lot of your vegetables as well. And I'm like, this is what we need to be eating. So that's my biggest complaint with it. That, and then the calorie restriction. I know my one friend was doing keto plus intermittent fasting, and she was barely getting like 1,500 calories a day. And I'm like, that's not healthy, because she didn't need to lose weight. That wasn't her goal.
Yeah.
And so it was like, no, you need to be eating more food. And then it was discovered she was having low blood sugar episodes throughout the day. And so she had to completely get rid of intermittent fasting with it, because you have, when your blood sugar is dipping, you need to be eating more often. So that was what I was seeing happen with her.
Yeah, and that's the thing. I think there's so many nuances that can go on. And I think, like you said, you made the point is like, what are you trying to achieve? There's so many people I see where I'm like, why are you doing this? They don't really know. And it's because like I heard it on a podcast, or read a book. And nothing against that, right? But it's, once again, it's like, do you need to do that? I think the ketogenic diet has some very profound effects for a very specific population. And some would argue that everyone could benefit from it. And I can see that argument, but I don't know how necessary it is for, how difficult it can be for individuals here, because that's really the key, is like, for anyone, what can they adhere to? With patients in here, like, if I can't get individuals coming to their appointments or doing their home exercises or following the plan, I could have the best plan in the world. It doesn't really make a difference because they're not doing it. And just like a diet, a lot of times the best diet is the one that someone will adhere to for a prolonged period of time. I'm not talking 6 weeks or a month. I'm talking, months to years, because consistency is really going to be key in getting the progress that we want.
Yeah. Well, thank you so much, Dr. Perry. This has been great information. Why don't you let everyone know how they can work with you? You are at Integrated Brain Centers in Denver. And again, the website is integratedbraincenters.com. And I know they can go online and schedule a free consultation.
Yep. So we work with individuals all around the Denver area, all around Colorado, and states nearing it. But we also consult and work with individuals in other states, people on the East Coast, the West Coast, Midwest, North, South, all around. And so we offer free consults to anyone. And kind of the purpose of this is to figure out and to review your case to say, okay, do we think that this would be a good fit? Or even to discuss, if you're in New York, who could be some good options to see in New York? Really, because a lot of individuals with chronic health issues are bouncing around from doctor to doctor. And you have some doctors who, once again, will charge $1,000 just to even talk to them, just to say, oh, I can't help you. And so that's the reason that we offer more of the free consult, is like, hey, let's talk. Does this make sense that we continue to discuss, or off the things you're saying, hey, here I think would be a good route for you to go, right? Because really the goal is to save people time and money and get them to the right provider quicker, versus everyone, especially in the alternative world, is really guilty of this, is, going to this person, that person, this person, that person. Everyone's got the answer. And so that's why we offer free consults. And like I said, we work with individuals, we work with other providers around the country, with patients.
Awesome. Well, thank you so much for being here today. And thank you everyone for watching. We'll get back again next month for more TBI talks. So watch your email for upcoming dates. I believe off the top of my head, I think it's October 3rd and October 26th are our upcoming dates. So thank you all so much for being here. And thank you, Dr. Perry.
Thank you so much, Amy.